You're listening to the Public Health Epidemiology Careers Podcast, episode 142.
Welcome to the Public Health Epidemiology Careers Podcast, where we explore public health epidemiology careers and share tips and strategies to help you enter or transition into the field. And now, your host, Dr. Charlotte Hughes Huntley.
Greetings, everyone, and thank you for joining me on this episode. In this episode, you'll meet my guest, Brittany Prince Evans, and you'll learn all about her journey into public health and her work with WellStart Initiatives. Let me tell you a little bit more about her background. Brittany received a Bachelor of Science degree from the University of South Carolina in public health and a Master of Health Administration from Clayton State University. She is a graduate of Emory Healthcare's Operation Development Program and Quality Academy. She also has a Lean Six Sigma White Belt certification, Tobacco Cessation Facilitator certification, and a Health Coach certification. Brittany currently serves as Assistant Director of Urban Health Initiative for Emory University School of Medicine and Engagement Manager of Georgia MemoryNet. She is the founder of WellStart Initiatives. WellStart Initiatives is dedicated to the development and implementation of strategies that will decrease health disparities. She created a mini campaign back in 2014 called Let's Move Manning in her hometown of Manning, South Carolina. The campaign encouraged preventive care such as healthy eating, healthy cooking demonstrations, walking, running groups, and group exercise classes. She currently serves as Chapter Operations Director of Healthcare Businesswomen and Vice President of DeKalb's Men's Health Task Force. She is also a member of Minority Health Connection, Live Healthy DeKalb Coalition, and Clayton State University's Young Alumni Council. I will connect that interview with Brittany right after this special announcement. Are you curious about public health consulting? Have you ever wondered what it's like? What do they do? How do consultants get started? Learn what it's like to be a public health consultant by attending the Expo. The Expo is an online event where a select panel of public health consultants and entrepreneurs who are passionate about the needs they address and the populations they serve come together and share their businesses. Attending the Expo is very affordable and convenient because it's available online. Learn about public health consulting from public health consultants who do it every day. Visit drchuntley.com and click on the Expo tab from the main menu to register and attend the Expo. Well, today I'm very happy to welcome my special guest to the podcast. Brittany, welcome to the podcast.
Thank you so much for having me. I'm so honored to be a part of this.
Well, it is my pleasure. I'm really happy that you're here. I look forward to learning more about your journey. And so if it's okay with you, I'd like to just jump right in.
Sounds great. Well, I'm Brittany Prince Evans. I have the privilege to serve others through public health. I consider public health to be a ministry. And I feel like if you do not operate in your purpose, you could be blocking someone else's blessing. And I got my undergrad from the University of South Carolina in public health. I actually started off in pharmacy, pre-pharmacy, and I kind of stumbled across the course of public health. And that's what kind of changed my major. It was just very eye-opening when I took the Intro to Public Health course, and it made me think about the disparities in my hometown. I'm from a very small town called Manning, South Carolina, and Manning is the county seat for Clarendon County, and our health disparities is worse compared to the state and the national average, which made me change my major to public health, which I'm sure we probably address later why. And I got my master's in health administration from Clayton State University. I currently have a Lean Six Sigma White Belt certification. I am a tobacco cessation facilitator, which I got trained at Mayo Clinic. And I also have my health coach certification, which I got that training from Emory University as well. I currently serve as the assistant director for urban health initiatives at Emory University School of Medicine. I also have a couple of different work hobbies where I am a part of the DeKalb County Men's Health Task Force, where I serve as the vice president. I serve as the chapter operations development director for Healthcare Businesswomen of Atlanta Association. I also serve on the Young Alumni Council for Clayton State University. I also have my own nonprofit called WellStart Initiatives as well, which I will elaborate later in the interview. And my day-to-day role is also working with Georgia Memory Net, which is trying to provide more services for people with dementia. I am also the engagement manager for that department as well under Emory University.
Well, needless to say, you're very busy. That is so impressive. And I think it's great because you're obviously really, you really enjoy what you're doing. And I really like the way you phrase it as the ministry. And it really is, it's important that you are, aware and really walking fully in your purpose, especially when you're aware of what you're called to do. And you know that you have the potential to reach many people by, being fully engaged in your work. So that's really great. And, we're both from South Carolina, so I do know where Manning is, even if our listeners are not familiar.
Oh, wonderful.
Yeah. So let's go back a little bit to, you mentioned that you were pre-pharmacy, but I'd really like to know, when did you first become interested in public health as a career?
So to be completely honest with you, I never heard of the field public health until I started attending college and undergrad. I honestly didn't know exactly what I wanted to do when I picked the major pre-pharm. I just picked it. I was just thinking of dollar signs. And as I was taking my classes, I felt like it wasn't something that was a passion for me. I felt like it was just something just to make money. And I did my internship, which I'm very grateful for having an opportunity to intern before I actually got into the field. And I was just thinking in my head, like, it has to be more. Like, what is there something that I can do before they even get to the medicine? And I had a friend, we took a lot of joint classes together, and she told me I should take a public health course. It could be a great elective. And she was just talking about this. So I said, okay, I'll take this intro to public health course. And so when I was taking the class, it really intrigued me. And when we were talking about social determinants of health, and we were just talking about like how your zip code, play a factor of your health outcome and things of that nature, all the different factors, it really got my wheels to turn. And it made me think about my journey and my hospital care. When I was in high school, I tore my Achilles tendon. I went to my local hospital. They told me because I could wiggle my toes, I was okay. So they gave me stitches and sent me on my way. My cut was very deep. That's the reason why I questioned was my Achilles tendon affected by it. I was also playing basketball at the time. So I was trying to hurry and get back on the court to play basketball. So I was lifting weights with my teammates, and I was having a really bad limp. So they gave me orders to take physical therapy. So I'm taking physical therapy on a torn Achilles, not knowing that it was torn. I was always in so much pain, not even knowing what was going on. And I also ended up getting an infection in my leg as well. And that would make my mom take me to a neighboring county to get a second opinion on what was going on. From that visit, they told me I had an infection, and they also ordered MRI, which was not ordered at my local hospital before. And that's when I immediately found out that my Achilles tendon was torn. I tore my Achilles tendon in September, didn't find out that it was torn until December, and then I had surgery in a different county. I was not able, because it was so long and I was taking physical therapy, lifting weights with my teammates, trying to play basketball as well. My recovery rate was longer than the average person. I had over 50 stitches in my leg, and I was not able to walk on my own without any assistance until April. I was actually even homeschooled for a while as well because I was bedridden. Come to find out that my hospital was ranked the top 25 worst hospitals in the nation at one point as well. It was a report that came out in 2012 that I read that my hospital was ranked. And it made me start thinking about close to 50%, it's like 40, a little over 40% of my people in my hometown, Atlanta, South Carolina, live under the poverty level. We have higher rates of diabetes, higher rates of high blood pressure, higher rates of high cholesterol, you name it. And so when they were talking about that in my class, it just really just made me think about my hometown and like, this is something that someone needs to do something about it. And I kept saying that, and I was like, why not me? Why not me? Why not I be the person? Which kind of started my business as well with WellStart Initiatives, my nonprofit. And I started taking just a little bit more public health classes that second semester. And I was like, this is what I'm called to do. I'm a Christian and I prayed about it. And that's why I said I use it as a ministry. Everyone does not have to be in a pulpit to operate for the purpose that God called them to be. And so that's what made me transition my major from pharmacy to public health.
That is, I'm really sorry that happened to you. It's horrible that you had to go through that. But I'm also really glad that you were able to, I guess, find your purpose in all of that. And you were able to really turn that around and find an opportunity to be able to help more people. So thank you for sharing that story, being transparent and really digging in, because that's really helpful to be able to hear your full journey and to, really be able to relate to the things that you're just explaining and parts of your story that are, I'm sure, not your favorite things to revisit, but it's definitely an example of how, a lot of us are passionate about public health because of either a personal experience or, something that we witness in someone close to us. So I'm really just appreciate you sharing that. And it kind of takes me to my next question. So, understanding, how you became interested in public health as a career, but how did your previous roles, the work that you've done, leading up to your public health role, how did that prepare you for the transition into what you're doing now?
Sure. So when I was an undergrad, I had the amazing opportunity to work with Healthy Columbia, which they had like an initiative of working with different zip codes in Columbia, how we can decrease the health disparities. And working with the amazing Miss Terry Jowers, it really opened my eyes of like, this is what I want to do, how I can be in this role, and which is what I'm doing right now. And so having that amazing internship, and then when I came to Atlanta, I had the opportunity to work with Clayton County Board of Health for my internship, working in public health, honestly laid the groundwork for my current role. But when I transitioned to Emory, I had an entry-level position, which was healthcare, but it wasn't public health. And so that was a role to help me learn the different systems within Emory, as well as going into the development program, which was kind of like a fast-track way for millennials to get into leadership positions at Emory Healthcare or University. And learning the different systems kind of helped me networking with the different amazing people that Emory, because we also have a great partnership with the CDC, which I have access to them to learn about different ways with public health and innovative ways that was going on. So that kind of really laid the groundwork for my work here in Atlanta. And I was honestly kind of stumbled across my job by fate. Because of the program that I was in with the operations development program under Emory Healthcare. So I said that the working with like data collection, that was definitely helpful for me. the Quality Academy piece, which I had the opportunity to participate with. Also joining HBA, which is Healthcare Business Women of Atlanta. I gained an amazing mentor through that process, and also networking with people that was in that development program to learn the different data softwares off the clock was also helpful with preparing me to the current role that I have now.
Okay. It sounds like you're always really, intentional, it seems, through your undergraduate work and doing the things that, you could do to really help prepare yourself. I don't know if you were aware of it or just it naturally came to you that way, but it seems like so much, you got a lot out of your undergraduate experience, as a student.
Yes, definitely very intentional. And also, too, I forgot to shout out to one of my other people who I consider a mentor, working at one of the local hospitals in Columbia, South Carolina, where he served as like the VP of Community Health. And when I had the opportunity to shadow him, and I asked him for advice of what should I do intentionally. So you're right. I was very intentional with every connection, every event. I go there with a plan. I look at who's going to be speaking. Do I need to network with these people? So I'm very intentional with every event that I attend, every person that I meet.
That's really good. That's definitely a good quality to have, and keep doing that. So I'm thinking about your passion for public health. So right now, what population or condition or public health problem are you most passionate about now?
Well, I am an African-American female, and my target population, I would have to say, would be African-Americans. And of course, we all know that obesity is definitely growing with our nation as the years go by. So I would say obesity because, one, I am a health coach as well, and how obesity is associated with so many different other chronic illnesses.
Absolutely agree. That is really interesting. It actually takes me to the next question I was going to ask you, was to find a little bit more about your business. So you are a health coach as well. And so is your ideal customer African-American women, or is there another way that you would describe your ideal customer?
So my ideal customer normally is African-American women, but of course I'm here to help anyone. But in the past, 90% of my customers have been African-American females.
Okay. And what products or services, or can you describe the coaching services that you offer?
Sure. So I don't want people to get the idea that a health coach is like a personal trainer, because that's what I'm not. So a health coach is basically responsible for educating and encouraging their patients in multiple areas, whether it's different wellness topics such as like work-life balance, nutrition, meal planning, exercising, self-esteem, different meditations. And we basically you have everything that you already need inside of you. So we're just trying to pull out those different qualities for you to help you get your goal.
Okay. And do you work with clients that are just in the area, your close geographic area, or do you work with clients, I guess broadly around the country, around the world?
All over. I haven't reached outside the U.S. yet, but most of my clients, I do phone sessions. So we set up calls via Zoom, and we have about 30-minute sessions that I give to my clients. And I also do like the first session free to see exactly how you feel about the health coaching. And then we could talk about different pricing, because I know that I really like to serve underserved minorities. And I know sometimes when you're working with underserved populations, sometimes fees can be an issue. So willing to work out different prices that can help them, that's manageable.
Okay. And so that's really helpful to know. And in the show notes page, you'll have the links to connect directly with Brittany if you want to learn more about her health coaching services. But Brittany, we're going to shift gears a little bit, and I'd like for you to share some advice, because the listeners of my podcast are typically kind of fall into two categories, either current students of public health working on their degree and hope to have careers in public health, or they're graduates who have completed their degree but are just having some challenges getting into the field of public health. So if thinking about just the students first, what career tips or advice do you have for current students who are interested in careers in public health?
Sure. First off, network, but be intentional when you network. Go there with a plan. I know sometimes when we go to different meetings and workshops, we just want to get business card friendly and just constantly just pass out without making a genuine connection. So if they have a list of the speakers prior to, I know sometimes too, they'll send out a list of who's actually going to be there. Maybe do your research before and make strategic connections to the events that you attend. Also, I encourage to start interning freshman year. Maybe like I had the opportunity. I started interning freshman year when I was in pre-pharm and noticed and found out that wasn't my calling. So that can help you, A, figure out that's your calling, and B, just start building up the knowledge that you need for public health. Also, getting a mentor is helpful. I feel like you need a mentor in all areas of your life, to be honest. I still have a mentor till this day. That can help you. Also, participate with different conferences, whether submitting abstracts, things like that, to get your name out there, to build your resume, that you have different publications before you even cross the stage. I think that would be very helpful.
That's a great tips. I agree with you, especially I'm always talking about networking. I have several programs that help, really help you with the strategic approach to networking because people just are struggling with it, but you need to be able to kind of take advantage of what the resources are if you need help with learning how to apply some of these strategies. But networking is very important. Almost all of my guests have that as a tip. So it's definitely something that, I completely agree with. I like all of the tips that you shared. I think they're really important. So thank you for that. So let's switch over to think about those graduates. So they've already completed their degree and they're just still having trouble getting into the field. So what advice do you have for them?
Yes. Be transparent with you. When I first graduated from USC, I thought that I was going to have a job just like that. And I was quickly humbled. And I probably filled out over 100 applications and probably got maybe one callback at one point. And it was very discouraging and a very uncomfortable place that I was in. And I said to myself, I have to do something different. So one thing, I strategically joined professional organizations because I was also new to the city. So the people who I've networked in the past, their reach was in South Carolina. So I had to be more intentional when I moved to Atlanta, Georgia. So I joined professional organizations where I also network and was strategic about it. I also volunteered at different organizations. It's okay to volunteer after you graduate, just to build up those relationships. With joining those different volunteering, it kind of helped me like, well, this person is good at this. Like if you're hiring, it kind of got my foot in the door for my entry-level position. Also, I encourage you to attend public health events and conferences too. And sometimes you can email the person who's over to see if they have like special discount rates or scholarships for people who may not be working. Because I know sometimes price can be an issue, but a lot of programs have scholarships in place for people who may not have the funds and want to attend. So the worst that they can say is no if price is an issue. As I mentioned before, always have a mentor that can help you and guide you through these. And also remember that even though it could be discouraging, you're trying to get into your field, that delay does not mean denied. So I don't want you to get discouraged in that awkward stage.
That's really good. That's a nice tip and a nice bit of encouragement. So thank you for that. Thank you for those tips. Those are really great. And we have your connection information. So in just a moment, I'm going to tell you how you can connect with the show notes page for this episode, and then also then further be able to connect with Brittany and follow her and learn more about health coaching and just reach out to her. But right now I want to wrap up and thank you, Brittany, for taking the time to be on the podcast and for being really transparent and sharing your journey. That is something that is, I think transparency is really powerful, and that's how we can help more people, just by being willing to be an example ourselves of, what we've gone through, and just whatever challenges we've been able to overcome and share our stories really helps so many other people. So I really appreciate you being here and you doing that.
Thank you so much for having me. I'm very honored and humbled to be a part of your podcast.
Thank you. And let's keep in touch.
Of course. Of course.
Awesome. Well, I really hope you enjoyed that interview as much as I did. I'd like to thank Brittany for joining me on this episode to share her journey into public health, as well as sharing such great career tips and advice for everyone. You'll find links to connect with her on the show notes page of this episode, which is episode 142. Just go to drchuntley.com and click on the podcast tab from the main menu, and then navigate to episode 142. You can also click on the Expo tab from the main menu to get the details and enroll in the Expo. All right, everyone. Until next time, have a fantastic rest of your day.
Thank you for listening to the Public Health Epidemiology Careers Podcast at drchuntley.com.